Welcome to today's episode of Health Talk, where we bring expert insights and discussions to help you stay informed and make better health decisions. I'm your host, Farik, and today we have a very special guest doctor, Maira, a leading oncologist. Welcome, doctor.
Thank you, Farik. It's a pleasure to be here and share some important information with your listeners.
Maira. Today's episode is a crucial one as we're talking about lymphoma, a type of cancer that affects the lymphatic system. Dr. Maira, can you start by explaining what lymphoma is and how it affects the body?
Absolutely. Lymphoma is a cancer that begins in the lymphatic system, which is a part of the body's immune system. The lymphatic system consists of lymph nodes, spleen, tonsils, and bone marrow. The primary function of this system is to help fight infections. Lymphoma occurs when abnormal lymphocytes, a type of white blood cell, grow uncontrollably. There are two main types of lymphoma, Hodgkin lymphoma and Non-Hodgkin lymphoma.
Interesting. So what exactly differentiates Hodgkin lymphoma from non-Hodgkin lymphoma?
The main difference lies in the presence of a specific type of cell known as Reed-Sternberg cells, which are found in Hodgkin lymphoma. Non-Hodgkin lymphoma is more common and includes a wide range of subtypes with different behaviors, treatment options, and prognoses.
Got it. So what are the symptoms of lymphoma that someone should watch out for?
The symptoms can vary depending on the type of lymphoma and the area affected, but common signs include painless swelling of lymph nodes, usually in the neck, armpits, or groin. Other symptoms may include fever, unexplained weight loss, night sweats, fatigue, and itching. Some people also experience pain after drinking alcohol, which is a specific sign of Hodgkin lymphoma.
That sounds alarming. So if someone experiences these symptoms, when should they see a doctor?
It's essential to consult a doctor if any of these symptoms persist for a few weeks. A doctor will typically conduct physical exams, blood tests, and imaging tests like CT scans or PET scans to diagnose the condition.
Now let's move to the treatment part. Dr. Maira, what are the main treatment options for lymphoma?
The treatment for lymphoma largely depends on the type, stage, and the individual's overall health. The primary treatment options include chemotherapy, radiation therapy, and in some cases, stem cell transplants. For some types of lymphoma, immunotherapy or targeted therapies are also effective. Chemotherapy uses drugs to kill cancer cells, while radiation uses high-energy rays to target and destroy tumors. Stem cell transplants, either autologous from the patient's own body or allogeneic from a donor, are used for advanced or recurrent lymphoma.
That's very comprehensive, but treatment can be quite taxing on the body. Are there any side effects that patients should be aware of?
Yes, the side effects depend on the specific treatment. Chemotherapy can cause nausea, hair loss, fatigue, and increased risk of infections because it weakens the immune system. Radiation may cause skin irritation and fatigue. Stem cell transplants are more intense and can lead to complications like graft versus host disease, where the transplanted cells attack the body's tissues. Immunotherapy and targeted therapies tend to have fewer side effects, but they can still cause issues like skin rashes, fever, and fatigue.
That sounds like a tough journey. What about the psychological aspect? How can patients and their families cope with the emotional toll of lymphoma treatment?
That's an excellent question, Farouk. A cancer diagnosis can be emotionally overwhelming. Patients often experience anxiety, depression, and stress. It's important to have a support system in place. Counseling or therapy, either one-on-one or in group settings, can help patients manage their emotions. Additionally, support groups where patients share experiences and advice can be incredibly beneficial. Family members also need support, as caregiving can be physically and emotionally draining.
Such an important point, Doctor. Maira. Now, once treatment is completed, are there any long-term care considerations or follow-up measures to keep in mind?
Yes, follow-up care is essential. After treatment, regular checkups are necessary to monitor for any signs of recurrence. This might include physical exams, blood tests, imaging, and sometimes biopsies. It's also crucial for lymphoma survivors to maintain a healthy lifestyle, including eating well, exercising, and avoiding infections. Emotional and psychological health also needs ongoing attention, as recovery can be a long process.
That leads us to the next big question. Are there any specific lifestyle changes or preventive measures that can help reduce the risk of lymphoma or improve a patient's recovery?
While there's no guaranteed way to prevent lymphoma, maintaining a healthy lifestyle can reduce the risk of cancer in general. This includes eating a balanced diet rich in fruits and vegetables, avoiding smoking, limiting alcohol intake, staying active, and maintaining a healthy weight. For lymphoma patients, avoiding infections is crucial, as their immune systems can be weakened by treatment. This means practicing good hygiene, staying up to date with vaccinations, and avoiding contact with sick individuals.
Great advice, Doctor. Maira, as we wrap up, what final message would you like to leave our listeners with regarding lymphoma?
Firstly, I want to emphasize the importance of early detection. If you notice any unusual symptoms, seek medical advice promptly. Lymphoma is treatable, especially when caught early. And for those already undergoing treatment, know that support is available, both medical and emotional. Stay strong, stay informed, and trust your healthcare team.
Thank you so much for your insights, Doctor. Maira, this has been a very informative and eye-opening discussion. To our listeners, we hope this podcast helps you better understand lymphoma, its treatment options, and the importance of ongoing care. If you have any further questions, feel free to reach out to your healthcare provider.
For having me, it was a pleasure to be here. And I request everyone to follow and subscribe the Care Corner, which bring you informative video which can really help you a lot. Please, my humble request, all of you to be subscribe and share also. Thank you very much.
And thank you everyone for tuning in. Stay healthy and we'll see you in the next episode. Don't forget to subscribe and follow us for upcoming video which can help you and your loved one. Do subscribe. Thanks you all of you. Have a nice day. Take care.